It has been a year since the historic healthcare reform bill was passed.
So what has changed and what is still to come? Professor Tom Oliver, director of the UW Master of Health program, joining us this morning to go through some of these changes, which are pretty extensive. So we'll give you a couple of minutes to explain something very complicated. What are some of the more significant changes so far?
Well, healthcare reform is really a toddler. It's just a year old. And so, as with many little kids, it's growing up. But some of the key things, there's hundreds of provisions because this is a whole system, just like our banking and mortgage system or our school system or our protection of food and safety. Healthcare is very complicated. There's a lot of roles for government. There's a lot of roles for the private sector. And so what the steps that we're taking so far are basically in 4 areas. Expansions of opportunities for people and their families to get health insurance and to keep it. Secondly, new rules to protect consumers in terms of the products that insurance companies are able to offer and the dealings with them in terms of limits and kicking them off of coverage and so forth. A third area is really the expansion of new services, particularly preventive services and new services for the uninsured individuals that come along with reform. And finally, a fourth area is experimentation and innovation with new models of healthcare organization and delivery. And so those steps are being gradually implemented all the way through 2018, though most of the changes will be in place by 2014.
Professor, is it too early to give credit or to blame healthcare reform as to how the system is operating now, just a year into it?
Yeah, I think it probably is, and I think public opinion is very mixed about it, in part because it's very hard when you're on the end of the system to really notice the changes as we try to improve things gradually. So I think it's very difficult and premature to make any judgments about its impact. The only thing we can look back at are other reforms in healthcare all the way back to 1965 when Medicare came along. There was an entire new program created within a year, and it was very controversial, but very, very shortly it became a wildly popular program and obviously has remained since those days. Also, just in 2003, President Bush and the Congress agreed to expand drug coverage for Medicare beneficiaries. That was very complicated, a very big deal, and again, very controversial. But just a few years later, I don't think anybody would take that away. So it's hard to say. I think the expectations will be, as time goes along, more and more people will observe concrete things that have made it easier for them, members of their family, or their fellow workers to, in their dealings with the healthcare system and the opportunity to keep and maintain reasonable coverage.
Why have reform in the first place and not just let the free market deal with it?
Well, there's so many areas in which there's not a free market operating already. The money that goes to our health benefits, if we're lucky enough to have them, is tax-free. That's already a government support of a private insurance market, primarily through employers. There's also the need for people who don't have an income sufficient to buy or don't have a job that comes with health insurance. So we have public insurance programs for people who are retired or low income or unemployed, Medicaid and Medicare. And so government is very heavily involved in many respects, and I think we don't want healthcare to be distributed purely the same way that we buy cars or we buy DVDs or our iPhones and so forth.
Okay, we're going to have to leave it at that. Professor Tom Oliver, thanks for joining us this morning.
Thanks very much.
We'll be right back.